Good afternoon. My name is Sister Daly. I met our presentation community at St. Michael's Academy in Manhattan when I was a freshman, and I graduated from St. Michael's in 1958 and entered the convent here in what is now called New Windsor, what had been called Newburgh at that time. And we had a very large group. We had 17, I think. Well, we just celebrated 61 years of entrance in September of this past year, 2019. And we still have 8 of the original people left, so we're kind of proud of our big number there. We, at the time that we were professed, after going through some of the junior community college here that our sisters taught in. Some of us were sent out to teach. That was what our profession was for many years in our community. And some stayed back and they went out later. They finished more of their education here. We had to finish our education either in an annex. I went to the annex of St. Thomas Aquinas in Manhattan, and that was, that was really towards the end when I was living in Goshen. My first assignment was St. Michael's in the 3rd grade, and then I was there for 2 years, and I was sent to St. John's of Goshen to the 3rd grade, and I taught there for 8 years. And one of the things that I saw was such a big difference. These children in the city were so poor. We used to have they would get lunch, a free lunch in the city. And they were so grateful if you could give them a couple of oranges or a couple of apples or a couple of extra sandwiches that were left over by the end of the day. And then I went up and found how easy it was for the other part of our world, where children were very upset if they got their brother's sandwich that had mustard and they should have had mayonnaise on theirs. But anyway, it was a great experience working with all those children. And then we were able, after Vatican II, to go into different works. And I went into religious education and did that work for 10 years at St. John's Parish before I went into the work of hospice in 1982. There was a position available with a group that was starting hospice in Orange County, but it was under the Department of Education. New York State looked at hospice as a form of health care, that they would provide support through Medicare and Medicaid, private insurance in some cases. So we were not chosen as one of the programs to be a demonstration. So the nurses decided to become incorporated into the Department of Education, and that's how I received the position, because I had been in charge of volunteers for 10 years in the parish, and one of the nurses involved knew what I did. And it was very interesting. We were in a very small office in a building where our treasurer was part owner of the building. And I just answered the phone. But one of the things that I found so very important is that I think it still happens today, but more so in those days, over 30 years ago, when people would call some organization for help and they wouldn't get a call back. And so many people, when I would call them back, would say, your organization is the only one that has called back and able to give us support. We couldn't do any kind of hands-on care, but we were able to arrange a lot of different things. One patient needed radiation treatments, and his wife couldn't drive him from Monroe, New York to Middletown. And there was a doctor who was in charge of the Department of Health for the county, county, and he was also a member of the, I forget what, it wasn't the Lions, but one of the you know, organizations that help all different people, and he had volunteers, and I took part as being a volunteer to take this man for his treatment, and his wife knew that he wasn't well, but his license was due, and he was probably to be renewed, and he was probably in his 80s, and we all knew that he wasn't going to be driving, but it was important for him, so I took him to the motor vehicle department in Goshen, and he stood there and had his picture taken, etc. And his license, unfortunately, did not come until the day after he died, but his wife was so pleased that he was able to get it, because it was a little thing to him, but it meant an awful lot. And that's what we find out, that it's the little things in life that do mean the most, whether they be the positive or the negative. But that was very positive for him. And then when we finally became, when they approved, the state approved of hospice in 1985, we had to submit another application. And by the time we was certified, it was 1988. We had a very small group, and of course we grew from that time. And then we had a very wonderful entrepreneur in Newburgh who gave us money toward our corporate office, which is in Newburgh, and we also have a satellite office in Middletown. We travel to see people in their homes. 11 years ago, we had a residence built so that we have people who need that 24/7 nursing care can be there and be comfortable, and their families can stay overnight if they wish with them. And we also visit people in the local nursing homes throughout the county, two counties. We serve Orange and Sullivan counties. We have a tremendous amount of staff since the first days, over 30 years. We're over 150. That includes nurses, social workers, chaplains, office people, etc., all different needs that we have to run a business. And one of the most important things that I found out was that the gift of our presence, and one of our sisters used to say that years ago, when she would come to a Jubilee celebration, she would say, "My gift is my presence." And that always stuck with me, and then I saw how important the gift of presence was, and I tried to help people to see that. Family members, and when we tried to educate nursing assistants and their, organizations when we went to speak, how important the gift of presence is. And a lot of times, especially years ago, people didn't know what to say to people who were very sick. And we tried to help them to see that you don't have to say anything special. Just try to have your normal conversation, because that person, whether they have 10 years to live, or they have 10 months or 10 weeks, they're still living. And the purpose, one of the purposes of hospice is to give comfort to the patient and the family as a unit of care, and to try to help that person live as fully as possible every day. And we've seen it happen in many, many different ways, usually small ways, but ways that made a big difference. And now we also have a connection with the VA, and we always have an honor salute for our veterans. And of course, it's their they have the choice of having something simple where they receive a pin and a certificate and a card from a child thanking them for their service to the country, or where we have a whole lot of veterans who come. The staff members that are working with that patient are there, and it's a very nice experience for them to be thanked for what they did, and to let people know that they are grateful that they had the opportunity to do that, to give of themselves for us, to keep us free. We also have volunteers who make beautiful lap robes that are red, white, and blue. somebody made a quilt one time, and the patient had it hanging in his room, and he was so proud of it. And of course, the lab, well, they were like quilts. Were not very big, but they were very lovely and warm, and very much appreciated. Sometimes it's just we had a patient who had a problem swallowing all of a sudden. And so he had to have pureed food. So I remember it was in the summertime, and I said to him, Jim, I said, do you like ice cream? And he said, oh, sure. I said, well, what kind do you like? And he told me coffee. And we had a place in Goshen that had homemade ice cream. So anytime I'd go to visit, I'd call him, I'd say, Jim, do you feel up to a visit and some ice cream today? So of course he always said yes. But then even as time went on, when it was harder to swallow, he couldn't finish it all. So we'd just put it in the freezer. Or maybe the nurse or the aide would bring him a milkshake, or you know, ice cream soda. But it's those, again, those little things that mean a lot and aren't any big deals that have to get, well, you know. But people like to tell their story, and they like us to share our stories with them, because it makes them feel that they're still part of the world around them and what's going on. They like to talk about different things that are happening. And it's, as I said, one of our goals is to help people live as fully as possible. And that's what we try to do. We have all different disciplines that are there as a team to give support to the patient and family. And I've been with hospice now for many years, from the very beginning, and in our community for 61 years. And we have learned so much from the people that we serve. And our foundress, her motto was, not words, but deeds. And I see that every day in everything I do, with every person I meet, whether it be a patient or a family member. And God is always there to provide and to make sure that you're there at the time when they need you the most. And that happens to me very often. It just happened the other day. And but it's never a coincidence. Because of our faith, we believe that God provides, and He provides in ways that we would think are very small, but they're not. They're very meaningful. So we learn a lot, and I think I always was told that we learn something new every day, and we do. We learn it either from the patient or from a family member or from a co-worker. So I feel very blessed that I'm able to be in this work and to serve as people, as Nano Nagel had asked us to help the poor, to teach. Many times we have to educate about the changes in the Catholic Church, and many different ways. But I am grateful to God that I'm still able to provide that care and service.